Public health for children, youth, and young adults. In 2009, Canada's Chief Public Health Officer focused on children ages 0 to 11. Life trajectories, also known as pathways, are experiences throughout one's life which can have an impact on their overall health, both positively and negatively. With children being most vulnerable and susceptible to the outcomes of these trajectories, careful examination must be taken in order to improve health outcomes. While the overall health of Canadian children is considered good, having one of the highest life expectancies worldwide, we now acknowledge the importance of social determinants of health. However, child well-being and its connections to the social determinants of health does remain understudied in our nation. Some areas of concern which directly impact children include socioeconomic status, abuse or neglect, prenatal risks, mental health issues, obesity, and accidental injuries. Despite initiatives by public health officials, child poverty is still prevalent in Canada and does have an impact in their overall health. Abuse and neglect is often difficult to discern what abuse is and what should be done about it in different scenarios. Prenatal risks are a concern because they are still a reality nowadays and are dependent upon the mother's own judgment in what she chooses to do with her body. Mental health is a concern because of the stigma against mental health illness. We must continue to raise awareness to reduce the stigma, as 1 in 5 children still suffer from mental health issues. Obesity is a concern as the technology improves, children are less physically active. An accidental injury is a concern because there will always be sports, risky behavior, and motor vehicle accidents to contend with, which are very difficult for public health officials to monitor. The 2011 report from the Chief Public Health Officer focused on health of Canada's youth between the ages of 12 and 19 and young adults aged 20 to 29. The goal is to assist youth to a smooth transition into young adulthood. Education is a large part of the 12 to 19 age group, with about 90% of the students ending up as high school graduates. Also introduced are some concerns from a public health perspective, including sexual and reproductive health, risky behaviors, and bullying. Information and education is key, and initiating the conversation about sexual activity and introducing the birth control options to a teenager decreases the likelihood of them having sexual relationships, and they are significantly more likely to use birth control if they do. Risky behaviors in regards to alcohol, smoking, and drugs are also explored during these years, which can cause both serious health risks and poor lifestyle habits. Young adults may experience a substantial amount of stress. About 1/4 report to have a significant amount of life stress, which could be due to education, income, personal issues, amongst other things. This can quite often coincide with mental health issues such as depression, anxiety, panic disorders, and eating disorders. Suicide is also a real concern for this age group, particularly for men or members of the LGBTQ community. Challenges for this age group also include preventable injuries such as poisoning and motor vehicle accidents. Issues for public health officials regarding motor vehicle accidents in particular include the young adults' overestimation of their own driving abilities, speeding, and not wearing seatbelts, all of which are difficult to monitor and enforce. The objective continues, and it is to make our children aware by educating and supporting our youth and young adults as they transition into adulthood.